Medical care is the core mission and work here at Catherine's. But if we only address the immediate medical symptoms, we're likely to fail our patients. Often the first hurdle that we clear together is building trust. After that, working together becomes a collaborative effort.
When I first came and walked through the doors, I was very depressed and was feeling pretty hopeless that I was not going to be able to coordinate my healthcare needs. I did have some insurance issues, but when I came to Catherine's Health Center, my anxiety was immediately put to rest. So I immediately felt like I'm at a place where they're going to help me coordinate the resources that I need to get over this very scary medical process that I'm going to have to go through, and they're going to provide me as much as support as they possibly can. It really was a really good holistic approach as far as, okay, this is what how we're gonna address these really heavy physical needs that you have as far as the surgery. And along with that, we're gonna get you set up with a mental health provider that I could also partner here with. So we can kind of talk about some of that clinical stuff that you're dealing with that are making you feel that this is something that you just can't get over. And we're going to immediately coordinate with your surgeon and do whatever we can to make sure that you get the support that you need to have this corrected. So I no longer felt alone. I no longer felt overwhelmed, that I actually had a really good medical team, because I have confidence that even though I don't have the right insurance, that through the navigation, along with the behavioral health, I'm going to be just fine. And I can't tell you how important that was.
Here at Catherine's, we believe that each person is special in some way. For some, these unique needs make finding services difficult. We work hard to serve each patient and be a medical home for people with a wide range of needs. In short, our approach is to meet these unique needs with dignity and respect.
Quinn is autistic. He was diagnosed at age 8 with Asperger's syndrome. Before that, ADHD. He takes medications for the ADHD, and one is a controlled substance, so that prescription has to be picked up here.
I've met quite a few different people at Catherine's, and they're all just so great and so amazing. And for me, autism kind of plays a big role in my life. You know, it's just, and I think it's kind of a learning curve having autism, I'd say.
I would just like to say how the staff here at Catherine's has treated my son. I've seen them I observe in the waiting room, and I kind of like to people watch, and I see the way they treat everybody. And it doesn't matter who it is. It doesn't matter who you are or what your issue is. I have seen nothing but professionalism.
They're just so understanding and just so, willing to help me assess my needs if, no matter what, no matter what's going on, how if I'm nervous, or they're just always there to help me out. They always just kind of have my back, and they always just kind of focus on that, and just if whatever I'm feeling, they're always there to help me out and just make sure everything's okay. And it's just really great knowing that they care about my feelings and just me as a person.
Our patients often find us in a variety of ways: friends and family, area health and human service agencies, and neighbors. It's not uncommon for our patients to arrive with several complicated health issues. Many have put off getting health care because they didn't find it realistic without money or insurance. Others are simply afraid, and they weren't able to get the support and education they needed.
I was attending a church function, anniversary celebration for my pastors with my husband, who's a deacon on the board. And long story short, in the course of being at that function, I wound up fainting. And when I came to, I was on the floor. Everybody was bent over me asking what had happened, and I absolutely didn't know. I just didn't have a clue what had happened, you know. And so anyhow, my daughter called a nurse practitioner who's a friend of ours, and who was a friend of Dr. Deb here at the center, and she says, you need to call my mom and pressure her to go in and get herself taken care of, because at the time we didn't have any health care insurance. You know, after my husband had retired from his job, essentially our health care ended, you know. Now he has health care because he's over 65 and he's getting the Medicare, you know. But I didn't have any, you know, and so I did find out that my blood sugar was dropping is what was going on. And so my family background has a lot of people who have had either diabetes or high blood pressure. I've had a few of them that have had some heart issues, you know, and so one of the things that kind of motivated me was that I didn't want to wind up like they did. Long story short, what Catherine supplied for me to help me turn the corner was that they gave me information of what I can do in order to take my health concerns in hand and be able to be empowered to do something to change it. By eating and drinking properly, I have the fuel that it takes to make it through the day and do what I need to do and have fun with my family, my grandkids, you know. And so I just really, you know, appreciate that. I love feeling like I can live now, you know, and don't have to fear or be afraid of tomorrow, you know, even knowing that Catherine Health Center is here. And so it's been great for me knowing that they're there and that they care, you know, the way that they do for their clients.